Okay, good morning, everybody. Good morning, DXN. I appreciate your efforts for coming so far. My name is Samuel Zoro, sales and training manager for DXN Nigeria. It's a privilege to have everybody online at this moment. Today, we are going to be able to listen from the wealth of experience from one of our great members. Firstly, I want to thank Dr. Lim for this opportunity, and also to our International Marketing Director, Mr. Jidit NK, who has been able to make this possible, always giving us his optimal support. Mr. Pradeep from India, when he came to Nigeria, he said, Mr. Jidit, it's a library. So a library which we can always get from his wealth of experience in DXN. And we always appreciate his support to DXN Nigeria so far. So everybody from far and wide, Africa and everywhere, we say thank you very much for this place, for this opportunity so far. Today, I'm going to introduce, he happens to be my very good friend. I've traveled with him, and I learned from him. Every step was a training. Dr. Koshy has been a very good friend. He's a father in DXN so far. He's not just a distributor, he is a popular plastic and aesthetic surgeon. And he works here in Nigeria. We are privileged to have him in Nigeria with Vedic Hospital in Lagos here. He's a crown diamond. He's a crown diamond in DXN. Being a crown diamond means you have 10-star diamonds under you, which is not an easy feat with DXN. So it shows that DXN is a possibility in achieving every goal. Also, Dr. Koshy happens to be a qualified surgeon from also India and the Royal College of Surgeons in UK, London. Very good, sir. And I love his strength because he's a very good marathon runner. He runs a long while now. He runs every day. For the past few years I've known him, he runs every year and even every day in running. So he won't even be able to predict his age so far. Also, he's the author of the popular book going on in DXN so far, in which we call Beyond Modern Medicine. He has done his medical studies in all around the world, in India and in UK also. So far today, we have his privilege, and we're going to hear from him so far. And I welcome not on stage, online, Dr. Koshy. You're welcome, sir. You're welcome, sir.
Morning. Thank you very much.
Thank you, sir.
Thank you so much.
So, sir, you can continue, sir.
Thank you very much. I think I shall speak and give an overview of the message that I intend to give in 20 minutes. And
okay.
Knowing Nigerians, people like to ask a lot of questions. So I think we can then go on to questions if there are questions, and then take it on from there. And then take it where the questions take us, we can go on in that direction. Okay. So the topic that I've given as a heading today is positive immune nutrition as the only exit strategy for COVID-19. So I shall just put everybody in the picture. Welcome to all the listeners, and it's a privilege for me to share my knowledge and experience with all of you. Okay, the reason why we are here, why the world is here at this moment in time, the reason why we are all wearing masks, the reason why we are all at home, why we are all practicing social distancing, is because the world immunity level, the immunity level of all the peoples of the world has been gradually coming down. That is why these mutated viruses, or these leaked viruses, or these viruses from the forest animals are finding their way and coming into our system. They have been coming all these years, but our immune system was keeping them at bay. So the answer to this problem is really in elevating our immune status. It is up to all of us as individuals, because nobody is coming to any given answers from modern medicine so far. And the answer really is there, is been there for the last 5,000 years or more in traditional medicine. It is in keeping your immune system intact and in health. That is the need of the hour. I will say again, we are actually maybe 50 or 100 years from now, people will call this era of ours as a dark era, an era where we were polluting the earth with no conscience at all. We are degrading our own soil. We are polluting our waters. We don't give a care to Mother Earth. That is what has led us to this current situation. So now, where did we go wrong as far as our immune system goes? The main point where we went wrong is in our own nutrition. Modern life and modern living has taken our nutrition to a negative immune nutrition predominantly. To tell this further, I have made an immunity nutrition chart. Could Mr. Samuel put the chart on the screen, please? The first time. Thank you very much. I have made a chart. There are two pyramids here, a pyramid on top and a pyramid on bottom. The pyramid on bottom, which is red colored, is the negative immune nutrition. In other words, anything in that red colored part of the pyramid makes our immune system lethargic. And the deeper you go, the stronger it is. The stronger is a negative immune nutrition. So if you look carefully, refined sugar is at the tip, at the bottom. Refined sugar is the greatest culprit in lowering world immunity of all the peoples of the world. And relying too much on animal milk and milk products. All antibiotics and all drugs of modern medicine pharmacy are acidifiers, including aspirin and paracetamol. And they actually bring our immune system down, the health of our immune system down. The price we pay in trying to keep our blood sugars intact, by trying to keep our BP intact with chemical medication, the price we pay is in a lowering of our immune system. Okay, all animal products are lowering our immunity, our immune system. Now, we should have a combination of negative and positive nutrition. I am not saying we should stop taking the negative nutrition altogether, but the negative nutrition chart should not be the predominant and the dominant part of our nutrition. Now, going up on the red chart, we have a line in the center that, if you look up on the right side, is overcooked food. Any food that is overcooked has lost its nutriency. Okay, so there is no point. So don't overcook your food if you want nutrient health. It is just a fiber only, not giving any nutrition to us. Okay, now all of Earth's produce, as you go up the positive nutrition, this is the need of the hour. All vegetables, fruits, and nuts are positive immune nutrition. Okay, then you go up in what we call in traditional medicine what is called as tonics. Tonics are alkaline food which has more alkalinity than normal vegetables and fruits and nuts, and hence they have a tonicity. Tonicity means makes you feel good. They are lemon, ginger, garlic, turmeric, ginseng, aloe vera, and most of the higher foods. We could even put the orange there, we can put avocado there, they're all alkaline. I will remind you again, everything in negative nutrition chart is acidic. And the more acidic your body tends to be, you are actually inviting ailments, diabetes, blood pressure, cancer, inflammatory diseases like arthritis, inflammatory diseases of the bowel, all come in an acidic environment. In fact, in an alkaline environment with high oxygen in the cells, cancer just cannot, the condition called cancer, a cancerous change cannot occur. Now, so I was saying on the tonics of the positive nutrition, that is lemon, ginger, garlic, turmeric, ginseng, aloe vera, which should be, they all should be part of our diet every day, or a predominant part. Intermittent fasting, that is in not overeating at all times, and fasting at least one day a week, gives our alkalinity a boost and gives all our hormones a celebration, as all our hormones are released when we fast. So intermittent fasting, and this is good news for all my Muslim people who are listening, because this is Ramadan time. You're all actually improving your immunity. It is amazing, and all of us should have intermittent fasting in our lives. Now, coming to the top of positive immune nutrition, we have some of God's gifts for us. Okay, among them I have put, being from DXN, I have put spirulina and reishi mushroom on the very top. They fast forward our alkalinity, gives an immediate boost, much more than even the tonic, and they are really the need of the hour. Somebody who is on spirulina and mushroom along with tonics and a positive immune nutrition cannot have any of these viruses coming and creating a cytokine inflammatory response which causes the respiratory failure. So with this nutrition chart still on the slides, let me tell you what is, give you a small overview on what is really happening with COVID and our immune system. Okay. Our immune system is really the essence of life. Okay, the white blood cells form our the main soldiers in our immune system. The white blood cells are there in the plasma part of the blood, and they are circulating at all times. Okay, in the alimentary tract, they keep our bacteria within the lumen of the GI tract. They don't allow it to come inside. Therefore, we have millions and millions of bacteria and viruses working for us in the GI tract. There is a pharmacy there all there already, but they're not allowed inside. If they come inside, we go into septicemia and negative status of life. Okay, so the GI tract is actually a pharmacy which is maintained by the white blood cells, not allowing them inside, but they're working in our pharmacy. Okay. In fact, all chemical medications interfere with this good and helpful bacteria. No, we'll keep it on that slide alone, please, Samuel. Let's keep that slide alone. Yeah, thank you very much. I'll come to this. Okay. Now, and in the lungs, we have the white blood cells again. When they enter the lungs, they become bigger in size, and they are called alveolar macrophages. Okay, they prevent any bacteria from coming inside, and hence if our immunity is intact, the COVID-19 cannot, they will come to the alveolus, that is the deeper, the inside part of the lungs, but they are not allowed inside in a good immune system. That is what is happening in 99% of the world population now. They are all not allowed inside, and the symptoms stop there. The lungs are not being attacked. But if they're allowed inside, again, we have a second line of immunity where the antibodies are produced in a very fine-tuned mechanism without any splashing of any inflammatory response. The antibody comes and neutralizes the virus, and life goes on. But if the immune system is incompetent, instead of neutralizing the antibody, the same white cells, because of its incompetency, produces a big cytokine response, which is what we are seeing, and the inflammatory response clogs the lungs, and the respiratory failure occurs even with ventilation and intubation. That is what is happening in the current situation in an incompetent immune system in the lungs. Now, if the immune system is incompetent, even after the antigen and the antibody has been neutralized, the complex X cannot be taken away from the blood. That is why you are seeing a higher level of coagulopathy and thrombosis in these patients. And if their thrombosis is not controlled, they go and clog the kidneys, and the kidney tubules also shut down. These are all what is happening in the COVID situation. So now, having come to this and having said so far, so it is very clear now, the answer for the whole situation is just to elevate your immunity. As an individual, as a community, as nations, we all elevate our immunity with positive immune nutrition and keep our immunity intact. In fact, if we are in our positive immune nutrition, we cannot have not COVID, any virus in future. I'm predicting there will be viruses in future. There has to be, from the forest or from the laboratory or from mutations, more viruses will come. Next time it may be causing meningitis and coma. We have to keep our immunity intact. Okay. Next time, even a ventilator cannot save us. So the answer is really in keeping our immune nutrition in the positive part of our of this pyramid and keeping our immunity intact. That is the way forward. Having said this, let's go to the next slide, please. I should just go on a bit more about immunity. I've drawn a triangle here. On the base, we have immunity and we have alkalinity. I remind you again, the positive part of the immunity chart, they're all alkaline foods. Okay. And the most alkaline foods on the planet are spirulina and the forest red mushroom called Ganoderma. That's it. All of Earth's produce are alkaline. Okay. Immunity and alkalinity are the basis for longevity. Okay, and longevity means longevity is a long life with health in the last day. Okay, now let's go on to the next slide, please, Mr. Taylor. Now, thank you very much. I have written, this is a different chart where there's a disturbance. Is it? I don't know why. And, yes, that's fine. Thank you. Also, this is a chart where I've drawn a circle. Okay, we have people who are very acidic on bottom and people who are alkaline on top. When you consider the population of the world now, I've drawn a circle. That is where we are. I'm sorry, the small letters cannot be seen. The acidic symptoms are when organs start failing, when immunity is low, when you succumb to viruses like the COVID virus, when you have gastric acidity, when you have kidneys that are failing, they all come in that acidic red part of the world. Okay, and an acidic body also creates an acidic mind. An acidic mind is an exclusive mind. That is, they are very narrow-minded. They tend to be jealous and tend to be, in general, not earth conscious. Okay, as you go up into alkalinity, there are a lot of people, possibly more than 50% of the world's population have an alkalinity in the circle I've drawn below. In the top of the circle line, of the black line I've drawn, those people will have no ailments at all. They will live a very satisfactory life. No viruses will come into them. They are very alkaline with a very good immune system. A cancerous change cannot occur in their body. It is as simple as that. And they will not need any hospitals till the very last day of their life. Shall we go on to the next slide? Please, please. Thank you very much. Now, the world can go down into the acidic range and everybody falls sick, or we can go up. And I think due to wellness revolution and in general, we are going up. We are going up. And at this stage, at the top of the circle, you will see a lot of alkalinity. At this stage, there is no question of exclusivity. You become very earth conscious. As an individual, you would not do anything to contribute towards pollution. You would not do anything to contribute towards the anything that is not earth conscious. I do feel at this time we will, lot of changes will come. We will go above our own religions. We will accept all religions. We go above religions, and only truth matters. Okay, and I also feel at this stage animal rights will be the same as human rights. And that is where the world is going to as we become more and more alkaline. And that is what alkaline nutrition takes us to. And the more we go up to the top of the pyramid, as I said, the superfoods, the more we take them, we fast forward ourselves into an alkalinity, a stage of no ailments, a stage of a stage of total inclusivity, of you include everybody as your own, including animals and everything that Earth has provided to you. Let's go on to the next slide, Samuel. Next slide, please, Samuel. Thank you very much. Now, when you come to the top of the range, there we come to a complete state of alkalinity. At this time, there will be, if all the world is in this circle on top, there would be no hospitals because there would not be any need. Everybody will know what is positive immune nutrition. Everybody would know what is good for them, and there will not be no borders. There will be nothing called first world or third world. It will be a shame on you to call somebody a third world sitting in the first world. First you make your neighbor first world, then you become first world. That will be the thinking. It is a thinking of inclusivity. That is what the alkaline superfoods and the alkaline foods take you towards, and your longevity starts increasing. It could even be double of what is currently in the world status now. Yes. Having said this, so the alkalinity and positive immune nutrition is the answer. It is a need for the hour. There is no point going after antibiotics to kill a small single RNA stranded virus, which is got an intelligence way above us. We do not even know how it is traveling for sure. Of course, we say a droplet, we are putting masks. It has gone all around the world. Okay, I think it is latching on dust and going all over the world. It is having a great time. And we are allowing, with our low immune status and our acidic status, we are allowing these viruses to come in. And in future, if we don't drop the alkaline chart, more and more viruses of this sort will find their way into our immune world, people, and immune system with immune nutrition is the need of the hour. We really have to go back to what people were doing 5,000 years ago, as traditional medicine talks all the time. It is all about positive immune nutrition, and that is the need of the hour. In DXN, I am proud to say we have this positive alkaline nutrition in the form of coffee, in the form of tea, in the form of capsules, and in all honesty and in all truthfulness, they just keep your immunity at top, and our alkalinity is fast forward to the top of this circle. Okay, Samuel, with having said this, I can take questions from you, or I'll take a pause now, take questions from anybody who wants to ask me. Thank you very much.
Okay. Okay, thank you very much, Doctor. Thank you very much. We appreciate
Okay.
your.
Thank you, Sam. If there are no questions there, I will tell you some more. I will talk about vaccines. I will talk about my own small interaction with a Nobel laureate who had come to my alma mater in 1983. And I can share that. That was the smallpox vaccines Nobel laureate, Jonas Salk, the injectable smallpox vaccine. I can share that with the viewers now. But we will wait for any questions that is coming.
Yeah, you can share, sir. You can share, sir.
Okay. Fine, let me tell you again. Okay, I'm telling you the exit strategy is only positive immune nutrition. Every individual has to keep his immune system intact, eating more vegetables, eating alkaline food, resorting to superfoods, and just keep your immunity intact, and share it with your communities and with your own nations if possible. That is the way to deal with COVID virus. Okay, I remind you again, we do not know. We are all going after a vaccine. Okay, there was no vaccine for the SARS virus, no vaccine for Ebola virus, no vaccine was developed for the HIV virus. Okay, so if we get a vaccine that has that is immunogenicity is enough to prevent, to give us good antibodies without giving us the disease, it is well and good, but it will take its time before, if it takes another 6 months, maybe another 100,000, 200,000 die. So the answer really is in immune nutrition. And if the vaccine is again coupled up with some company making money, everything will become questionable. Everything they say is questionable. So we have to resort to immune nutrition. And if you go back and look at my positive chart again, the positive chart is so cheap. Vegetables, fruits, lemon, garlic, it's less than $1. It is less than it's 1,000 naira here in Nigeria. Anybody can afford it. And there is no point going into high profunda stuff when we have a nutrition in hand, and that is the need of the hour, and that is the only answer, and that is the exit strategy that we should resort to. Now, in 1983, I'm happy to share with you. When I was in my third year medical school, I had won the immunology gold medal for a write-up on monoclonal antibodies. Okay, that was, at that time, cancer was a big problem, and we do not have the level of what shall I say, radiation at its highest level and chemo, and those are all not the answers, but we didn't have it at that level. So monoclonal antibodies was when you take a cancer cell and inject it into a mice, and the mice produce an antibody. Okay, that antibody is taken and it is coupled with the cancer cell of the patient. So it is an antibody which is replicating at the same frequency, at the same speed as the cancer cell. Okay, you can also couple it with a chemotherapy agent. Okay, that is called the chimeric principle. Chimera is a Greek god with a lion's head, with a goat's body, and the snake as a tail. So you have a cell which is an antibody to the cancer cell, coupled with the patient's cancer cell with a chemotherapy agent. So a cell with three properties. Okay, it's all recombinant technology. Okay, so when you inject it back into the patient, you can actually you can kill the cancer because you have an antibody against the cancer. But it doesn't work really. Even though I won a medal that day, it does not really work because it produces huge antigen antibody complexes, and the body goes into a state of coagulopathy. Okay, into thrombosis. Body can't get rid of the antigen antibody complexes. So the bulk of this again goes to the kidneys, and the kidneys shut down. So this is the principle of monoclonal antibodies. This is also the principle of convalescent antibodies. That is, if I have recovered from COVID, my body will have antibodies. I can inject that if it is compatible to another patient with COVID, another patient who is dying. However, the patient's body has to get rid of the antigen antibody complexes. These are all possible ways of treating, but immune nutrition is the way to go. Now, Samuel, I will just go on to another point, which point two. Okay, let me just put other things in perspective also. Okay, let us use common sense here. Okay. For example, today, Nigeria's total deaths as of today on Google is 178. Okay, India is around 1,700 deaths from COVID. Okay, let us put this into a picture. Okay, our mindset is all about COVID now. Okay, 178 or 200 deaths would have occurred a single day in Nigeria, in Lagos itself, from road traffic accidents, from the Okada, the bike accidents itself. India sees 1,000 deaths a day in its cities. These are the deaths over 4 months, 1,700 in India and 178 in Nigeria. This is what Dr. Salk, a very humble man, he was a Russian Jew. He visited us, and I had the opportunity of listening to him, and he talked to all us in the stadium. I still remember every word he said, every slide he put on. He had actually, he's a Nobel laureate. He did not take any patency for the Salk vaccine for smallpox, but he reminded us, okay, smallpox will be eradicated. Okay, at that time, his rival oral polio vaccine, Sabin, was also coming out. And he said, we will eradicate smallpox. But he said, it is not a big thing. Smallpox deaths are so, and the disability is so minute compared to cancer deaths in children, cancer deaths in the world at that time in 1980s, I'm talking about. He was very humble. So I will put it in perspective. Our mindset, we are so worried about this COVID virus. Why are we not worried about the road traffic accidents? Why are we not shutting down till all the deaths stop? So just giving another angle, which I got from Dr. Salk that day. However, I'm going back to my point again. Positive immune nutrition is a need of the hour, Mr. Samuel.
Positive immunity is the way forward. Thank you very much, Doctor.
Thank you, Samuel. Yes.
Thank you very much, Doctor. I have a question here.
Yes.
The person is asking, in using DXN products, so far, DXN products in Nigeria is now 15 with the arrival of our Morinzi Jews we've been expecting. So the person is asking, which of the products can we use to boost our immune system? being that before they say ROGGL and spirulina are good in boosting our immune system. So what happens to the coffee and the morinzi we have? So which of the DXN products can be used to effectively boost our immune system?
Mr. Samuel, thank you very much. And let me
Yes, sir.
explain each of these parts. Thank you very much. The answer to that question is, if I had a choice, and I have today symptoms, or I'm thinking I've gone in touch with a COVID person, traveled in a car with him or in a plane with him, and I know my immunity is good, but I want to take care of myself. The first thing I would do is I will take 5 spirulina and I will take 1 linseed coffee black straight away. I'll put half a sachet and make a hot cup of coffee. I have 5 spirulina. That is the immune boost I get from at least 10 ginger, 10 lemon, 10 garlic, and 1 whole glass of turmeric powder or more. It is much more than that. Okay, so my first choice would be spirulina because it is the because the alkalinity is instant. Spirulina is water soluble. It is grasped. It is immediately the body takes in, like you take in your lemon juice or turmeric powder, and so is the coffee. Okay, now, why did I say coffee first? I will tell you. Okay, so first choice would be the spirulina tablet or the capsule. The second choice is the coffee. The coffee, let me tell you again, it is Dr. Lim has made this coffee available for us. It is made from the body and spores of the mushroom. Okay, even I'll tell you, we have RG and GL, okay, which are 2 capsules, and the GL is a root of the mycelium, the root of the mushroom, and we have RG as the body of the mushroom. The coffee has something more. It also has the spores present on the body of the mushroom. So the coffee immediately gives you that alkalinity and the immune boost. Okay, now what happens? What really happens when your alkalinity is there? Okay, the white blood cells are like a fish swimming in water. Okay, if the water is too cold, the fish is unhappy. Okay, just imagine I am the fish or you are the fish. We are the fish swimming in water. If the swimming pool is in body temperature, that is what the alkalinity gives to the white blood cells. We swim so well rather than when it is too cold or too hot. Okay, now 1. 2, the vitamins, the high dose of vitamins in spirulina just gives an immediate boost. The white cells need all the vitamins, vitamin D, A, C, B, everything is needed. B2 is needed, B1 is needed, the immediate vitamin boost. It is like saying, you know, I will give you the example again. People tend not to believe me, but it is actually immediate. For example, okay, you go to the petrol pump. Okay, you see you have got a nice car, and you see super oxidized, or what do they call it, super petrol for a smoother driving. The moment you put your super petrol, the car is smooth again. Exactly what happens when you it is immediate. The petrol is given as a nutrition to the car. The same thing happens here. Now, RGGL is more alkaline than spirulina, and RGGL can be given immediately too, just like spirulina, but the absorption may be a bit more later than the spirulina. Okay, and RGGL, for its maximal effect, for somebody who is taking every day, there is no problem. You can take an extra 3 or 4 or 5 or even 10 capsules for immediate boost. There is no toxicity. It is just like food. But for somebody who's taking for the first time, the RGGL takes a few days, sometimes 2 weeks, 3 weeks to amalgamate into the body. That unlike the spirulina. That is why I said spirulina with the linseed coffee is the first choice. Now, there is one vitamin that is lacking in spirulina and in the RGGL. That is vitamin C. Vitamin C is there in plenty in morinzi. So you take 30 ml of morinzi in the evening, maybe around 6 p.m. or any time you want. Your nutrition is intact. The alkalinity is amazing. And it is not only your immunity, your health upgrades in every way you can imagine. So those would be my choices. Yes, thanks.
Thank you very much, sir. Thank you very much, sir. Okay, this second question. Oh, this one is okay. He's saying, as a surgeon, as a popular surgeon you are, how has DXN products help you in your field?
Thank you very much. Thank you very much. First of all, I will talk about myself. Okay, the DXN products. I will share with you. I am 58 years old. Okay, I start my surgery at 6 a.m. in the morning. Now in Vedic, maybe around 8 o'clock in the morning. Okay, my mind is so clear. Okay, I never get angry because of the alkalinity in me. The Rishi Gano and the Ganocelium have given me so much nervous coordination. My nervous coordination is like a small teenage boy's coordination. I have no shivering. It's so clear, and my surgery is like ever before. And with my experience, it is at its peak. That is what DXN has done to me. However, once I started giving to patients, okay, their wound heals about 3 times or 4 times faster than a normal patient when the patient is on spirulina and linseed coffee, okay. And then any patient that comes to me also has comorbid conditions like diabetes, blood pressure, gastritis, or even sickle cell crisis. When I give them these, my treatment becomes divine. I'm not a surgeon anymore. I bring divinity, because the whole patient's ailments start going away. I can share with you. I would like you at this time share a YouTube video of mine after our talk. It is called Divinity in DXN. Dr. Koshy, how I've shared some of my patients from all over the world, really, who I have put in these. I give it to every patient. I bring divinity in. I start treating the patient as a whole, and my surgery has exemplary results, thanks to God and thanks to what I give them in the nutritional products in DXN.
So it means it helps your patients before and after surgery.
That's correct. That's correct. In fact, I would refer you again to my YouTube talk. There was for example, every single patient is a story to tell. It's a story to tell. And I will not tell, even every day I get 2 or 3 positive messages every day. I will tell you of this small girl. This was about 6 years ago in India. She was brought 3,000 miles away from a city very, very north called Kolkata. They came to me, and baby was 1.5 years old and very thin and malnourished, and baby had multiple problems, and the main problem was a big cleft lip and a cleft of the palate. So they came to me and said, none of our surgeons are willing to operate on our baby. We got this baby after 15 or 20 years of marriage. It's a precious baby. She has these problems. We have come to you, sir. They were both advocates, the father and mother advocates. So I said them, thank you very much. I will operate, and I will give you a good result. It will be my aim that this girl will grow up and nobody will say that she ever had a cleft lip. I will make that happen for you. But I will do one thing. I want this baby to take a tablet called spirulina every day, 2 in the morning for the next 1 month. Then only I will operate on you. I said, no, sir, we are from 3,000 miles away. We are practicing lawyers. We have brought my baby's grandmother. My mother is with me. We have come by flight, sir. I said, don't I know that? When you traveled 3,000 miles to come to me, you have traveled over 3,000 plastic surgeons. Yet you came to me because you heard something maybe. Am I right? They said, yes, that's correct. All right. Now you have to listen to me. I know everything, and I can envisage the result. But I want you to do what I said. They said, doctor, are you serious? I said, I am absolutely serious. With this, I would like you all the listeners, to look at YouTube Divinity in DXN. These babies' pictures are there, pre-op. 1 month after spirulina, I operated, and see the result. A result that would never have occurred if I had operated without building up the immune system and the wound healing and the baby's health in general. Yeah. Thanks, Samuel. Yeah.
That's nice. That's nice. Very nice, sir. Okay,
Yeah.
this question is okay. The person is asking that for a surgeon, you should be earning good money for a surgeon. So why? Yeah, money. You should be earning money. So why how has DXN added to your financial capability?
I don't need DXN for my financial capacity at all. For me, I will tell you, for me, I do not do DXN for financial this thing at all. I am really not interested. I have never taken a single retail profit or anything. I am here because of the results it's given to me and to my patients. Yes. That is my honest answer to you. Yes, but people who are experienced this must do it, because to me, I have learned that MLM done in the right way is the only correct way of doing any, especially in the pharmacology world. You know, when you buy insulin, or you're just contributing to a billionaire company, to a one family somewhere in the West or wherever, who may not even be interested in health in general. They're only interested in, that is why even a vaccine, if it comes to a financially benefiting company, everybody will have his reservations on what they say. So MLM is the most fruitful way to go, and I have learned that. In my own state, people ask me, "Sir, why are you doing this?" I don't need to do this. I do it because this is the only answer. This is the only answer which I've seen, and I have no qualms about it. And I say it openly. If people take it otherwise, "Sir, you are lying," no problem. If you say I'm lying, I have no problem. But I can confidently say I have not said a lie ever since I've reached an alkalinity in the last 10 years. So, so I don't need this, but I do this because it has changed my life. It changed every patient's life. Yeah.
Oh, okay. Okay. So now the question is now is for people that are not that financially buoyant enough, how can they grow with DXN to be financially independent?
Thank you very much. See, I will tell you something. Okay. I think I will take your question in two ways. One, you are not financially able to afford the DXN products, which I doubt. Which I doubt, because a box of just a box of spirulina, which is one capsule of spirulina, will be worth around 4 or 6 naira. Okay, it has the equivalent of at least 10 kilograms of any fruit and any vegetable that you can find. So once that is impressed upon you, you will find a way to get spirulina for yourself. Okay, and now somebody who is not financially capable, I would say, once you have taken spirulina for 1 week, everybody who takes it, your body will change. Your father will ask you, your cousins will ask you, "Hey, are you going to a gym? What is this? You're looking so good." And your friends will ask you. Then you share them, make them buy, and as they buy, you get your own small bonus, and from there you start on. That is what I would advise. If supposing, on the other hand, I say you go to a doctor and say, "Well, there is this medicine worth $50, and that will be the best for you." People will have no calm. They won't even check Google. But you throw a small, lowly spirulina, they will go and check Google. What are the side effects? What are the toxic effects? While you don't check the toxic effects of paracetamol or aspirin or any antibiotic you take. That is the mindset of the world. So I don't think finance will be a problem at all for somebody who understands. You will find a way. You should find a way.
Oh, thank you very much, doctor. Okay, this one seems to know you very much. He said, okay, that recently someone from your team became a star diamond. I think he's talking about Akash Prakash.
Yes,
how was it possible for your team to be able to bring out a star diamond in a short period when DXN just launched in Nigeria? What was the strategy, basically?
Thank you very much. Thank you very much. Okay. Our well, the strategy is actually very simple. Akash, I thank you very much for your question. I'm very glad that you're listening to. I know you're very busy these days, and I'm very glad for you that you're listening in, and I'm very happy. I'm very happy. Yes, my strategy was to make everybody understand. Okay, as Akash, you yourself know, within a week of taking spirulina, you took 2 or 3 weeks after I told you, and we had some problems in getting it in also. Yes, but within a week you knew that if I can just share your own experience with all the viewers. You immediately said there was your hair started growing at a faster rate, your nails started growing, you started waking up early, your runs became faster, all within a week. Within a week, these are the changes that happened to you. I made you share this with all the other people in and around Lekki, and that is how our strategy for Star Diamond was. We're just sharing your experience. Okay, if I say my experience, they will say, "Oh, you're from India. You're from you had many other vegetables, many other secret concoctions, maybe." But when it happened to you, I just shared your experience with the team, and that was the way forward. And then later on, people started emulating you. They started taking, and they found the same change, and they were all sharing their experiences. And if I can tell the names out, Chioma, Glory, Sandra, everybody. And it's been a pleasure. It's been a pleasure. You are sharing health, and it's a great happiness that you achieve. That is, you must enjoy it all the way. And Star Diamondship is very easy, as you know. Thanks, Akash, for that question. Thank you.
Oh, thank you very much, sir. That's the question I have so far. Really
Yes.
appreciate.
Thanks, Samuel. Do you have any questions, Mr. Samuel, yourself? Or?
My question, you know, I've been asking you my questions all around, but my question is that what inspires you to continue with DXN for so long? What is this? Because you can't see a distributor in other MLM companies stay for 2 to 3 years. They tend to cross carpet to the next available quick money company. But so far, what has been inspiring you to continue with DXN for more than 2, 3, 4 years? What has been the inspiration?
Thank you very much, Mr. Samuel. I tell you once again, I am not in DXN because I make a living with my profession, but DXN has changed my profession. Okay, even 2 days ago, if I can, I will share with you. Akash is listening in. We have one of my own junior doctors called Dr. Iebosa. Okay, we had 5 minutes in the hospital. We were talking about a patient, and then she just said, "Sir, I do not know. You don't have your patients just start walking immediately after the surgery. Your results are amazing. I think you are the world's best surgeon." This is not the first time I hear that. I hear that from patients. That is what keeps me in DXN. It is not me. It is the spirulina. It is the linseed coffee. It is the reishi mushroom. What more do you want, Samuel? What more can I ask for? What more? This is beyond money. That is what has kept me. And again, I ask everybody listening in, let's see the YouTube channel. It's only 5 or 6 patients of mine, and how my own running times changed, patients' results changed. And I spent, wherever I go, you know, they say, "Hey, your results are world class." Of course, I'm experienced, I'm careful, I'm safe. But DXN makes that difference in my life, in my professional life. So there is no question. I will stay in DXN even after I stop operating for my own health and for keeping others healthy. I will continue DXN. I'm very, very grateful. Very, very grateful. Yeah.
That's good. That's good.
Mm-hmm.
So also in your journey so far with DXN, how many countries have DXN taken you to based on DXN business? How many countries have you been to?
Thank you very much. Thank you very much. Actually, I'll put it the other way. Wherever I've gone, I've taken DXN. I must say, I was quite instrumental, along with Professor Basupalaya, Mr. Jijit, to get DXN to Nigeria. And so I very instrumental in getting DXN Nigeria here. And then I did spend 1 year as a medical director of in Kinshasa, this Congo's largest hospital. It was a pleasure there. I took DXN there too. There's a Star Diamond there. Can you believe it? A Star Diamond there. It's like Akash, Star Diamond there. And so that is Congo. And then one of my own patients from India has taken it to Canada on her own line to Canada. And another patient has taken it to Kuwait, to Dubai. So it's really, it's just not me. Anybody can do this. Anybody can do it, and all should do it. And all should do it. And so wherever I've gone, I've taken DXN with me. So, and in many parts of India too. Yes.
Oh, thank you very much, sir. Thank you. Thank you very much, sir. Okay. That's the question I have. Really appreciate your efforts so far in your tight schedule. So always
thank you very much.
Support us. Due to the lockdown, we would have been in Uyo. But I really appreciate your.
That's correct.
Your support always. Like I don't know if we have other updates from management here. I don't know, my colleague, our warehouse manager, if he's present, so that he can give updates on what is happening so far in the delivery and warehouse departments. Mr. Alex, are you online?
Sure.
Okay. Mr. Alex, are you with us? Oh, okay. Always busy in the warehouse. Members are making purchases, and he's trying to make sure everybody gets their purchase and processed properly. Okay, I will help him in assisting in doing the delivery updates. Okay, delivery update is still going on so far in Nigeria, even in the midst of a lockdown. So all your products are being delivered in due time. So
yes,
no cause for alarm. Also know that there is a free delivery promo so far. If you make purchase 100 PV and above, is a free delivery anywhere in Nigeria. So always make sure that your purchases are always 100 PV and it will be delivered to your doorstep. People have been saying that, I've been asking that, is it to their office or what? I said, no, it's to your doorstep. So make sure you provide a valid phone number and very valid address also, and it will be delivered to you also. And for the promo going on, let's make sure we utilize the promo going on, make maximum purchase in the month of May, and you get 100% redemption for 6 months and 1 year respectively for all Nigerian distributors. And we pray for the lockdown to be eased and then everything come back to normalcy. Then our brothers in Ghana and other places in Africa trying to make purchase, we are always available. When the lockdown is eased, we will move to you, all products available for you. Please bear with us, and everything will be done systematically. I really appreciate everybody for this effort. If you want to make your purchase also, there's an online purchase so far. Go to the website, you can make purchase online and to be delivered to you to your doorstep. Also, if you have issues, you can always contact us via our WhatsApp. We have a Facebook page, we have an Instagram page. You can communicate with us anywhere. The team in Nigeria, we are very active, and we are always here to support 24 hours, because most times we get inquiries from worldwide because of the time difference, and we are always available 24 hours to listen and assist you in your products. Some people tend to make purchases and they tend to overpay and underpay. So we tend to let you know that, okay, please let us know your purchases, and we're going to assist in making your purchases and sending your order to you. Also, people are asking for the combo, the promo going on right now for the 100% redemption. FS combo, the promo is also part of the products, because in the 100% redemption, if you purchase any of the promo kits, it is not part of the redemption promo. But FS combo has been included thanks to our IMD, Mr. Judith. He has added FS combo. So if you make purchase of FS combo, it is still included. It will be included in your 100% redemption. So there's no cost for alarm. Please make purchase anytime. Don't be wary. Please, let's do the business with integrity and trustworthiness for DXN to promote what? The health, wealth, and happiness in the world. Thank you, Dr. Koshy. Do you have any last words for the listeners before we go? Do you have any last words?
Thank you, Samuel. Stick to positive immune nutrition. Stay healthy, stay safe. God bless you all.
Thank you very much. From the team here in Nigeria, all my colleagues, I appreciate your efforts so far. Even the lockdown, you are doing 100%. Thank you to our IMD, our father who is covering us, Mr. Didit. Ms. Mitch in Philippines, we appreciate you wherever you are. You're always supporting from there. Thank you very much. Our operation manager, Mr. Igor, my warehouse manager, Mr. Alex, Sally, Jennifer, Ifoma, my colleague, Mr. Emmanuel and Joshua. All of you have been awesome so far, not giving any loose side. Thank you very much. From DXN Nigeria, from Dr. Koshy, I say thank you very much for this. I appreciate all of you. Have a nice day. Good morning, DXN. Namaste. Thank you very much, sir.
Samuel, all the questions have been answered?
Yes, sir. Yes, sir. Do you have more questions, sir?
No, I just asked if all the questions have been answered.
Okay, sir. Okay, sir. Please, we would like to hear from you too, because I was appreciating you now, so it will be an honor for you to say something to the African viewers and Nigeria as a whole too, sir.
Yeah, okay. Thank you very much, Dr. Koshy, for taking out the time for all the people. So all the listeners, just I want to tell you that now, as doctor said, boosting the immune power is the only solution to beat this virus, because there is no vaccination yet invented, and we do not know if people will be able to invent it or not. But the easiest way is to take care of our immune system, and DXN products are proven to be effective in this purpose. So please take our products regularly and be safe and continue to do your regular work without any problem. Okay, and as Samuel said, we have launched a new promotion this month. Please buy as much as possible this month, so that in the coming 1 year you can get the discounts from your purchases up to 10% of the invoice. So this is a great promotion Dr. Lim has launched for the people all over the world, to help during this troubled period. That is the purpose of this promotion. Up to 10% you can get back, but you need to maintain 100 PV and as much as possible this month. And next month onwards, you have to buy 100 PV, then you get the discount. After 100 PV, you can buy even in single bill or multiple bills. You can buy products, but first should be 100 PV. Okay, so that is a condition. More than 100,000 Naira, if you buy this month and last month together, you can get it redeemed up to 1 year. If it is less than 100,000 put together May and April purchase, it will be 6 months.
6 months.
So that is the thing. I'm happy that Nigeria is safe, and Nigeria business is also growing well. So far all the months we have been marking growth in our business, and it's good sign that we will be able to achieve higher levels in the coming few months or few years even. That is not a problem, as long as we keep the growth intact. So this is the opportunity. Even millions of people have lost job all over the world, but DXN business is one business which people can rely upon and continue to do, because people are looking for an opportunity how to survive in this period, and this business is something which will help all the people to survive, not only survive but to thrive. This is because you see now most of the industries are shut, most of the industries are not working, but DXN business is still going on all over the world. No country where our business is completely affected. Of course, it has been affected to some extent, but some countries we are doing double the sales than normal. It is because of the necessity of the products and the greatness of the business. So please give this opportunity to as many people as possible and help the people to combat this situation. That's all I want to tell you. Thank you very much for your time, everybody. Take care and see you again.
Thank you very much, sir. Thank you, sir.
Thank you.
Yes, sir. So from us in Nigeria, remain safe, practice social distancing, use your sanitizer, please, and also boost your immune system with DXN products. You can use our promo, our ROGGF Farina. The copy is always available. People asking that and saying they're thinking we're out of stock. We are not out of stock. We have them in stock. The warehouse departments are working tirelessly to make sure everything is in stock. The purchases are increasing every day. Please make your purchases and we will always deliver to you. I have a question for you, Dr. Koshy.
Yes.
Okay, this person is saying, good morning, Dr. Koshy and Mr. Samuel. How much is the quantity of raw ginger and lemon and garlic can be taken in a day?
Thank you very much. Thank you.
Okay.
Thank you. The answer is till you feel tired of it. That is the answer. But actually, people make ginger, garlic, and lemon paste all together. Okay, for maximal effect, you take them all with the skin, you chew in your mouth, and you swallow. The immune boost is immediate. Okay, however, you can take a second time after 4 hours. After that, you can't really take it in. Your body itself will say. So the answer is, rather than take it a third or fourth time, the answer is to take spirulina. Spirulina is like taking 10 times ginger, garlic, and lemon together. But if you want to take, it is as much as your body allows you to take. Your mind will say, I don't feel like taking the second time or third time. So that is it. But there's no limit. There is no toxicity. There is no limit, and alkalinity is always good. The body welcomes it. Welcomes it.
Sure. So for all our products, you can use our products. It's for any age, anybody. If you are asking for even pregnant women, it is perfect for pregnant women. So if a pregnant woman can use our products, then anybody can use the products. So it's very effective for pregnant women. So no cause for alarm. Our product is very effective for everybody, mild to control, and also make sure you use to boost your immune system at this point in time. It is very important. And always wake up and sleep with a cup of coffee like I do. Thank you very much, Dr. Koshy. Thank you, our IMD, Mr. Judith. From us in Nigeria, namaste, and have a good day. Bye, sir.
Thank you. Thank you, Sam.
Yes, sir. Yes, sir.
Bye-bye.